Hello again, everyone. Today, we'll delve into a crucial topic that affects many men worldwide, and that is the topic of prostate health. I'm Dr. Daniel, and over the course of the next 3 to 4 minutes, we will explore two conditions that affect the prostate, namely benign prostatic hyperplasia and prostate cancer. But before we go further, let's begin by understanding the prostate, which is a walnut-sized gland located below the bladder, surrounding the urethra. It plays a vital role in male reproductive health by primarily producing seminal fluid, which is the fluid that nourishes and transports sperm. Now that we are familiar with the prostate, let's discuss the two common conditions that affect it, which are benign prostatic hyperplasia and prostate cancer. Now, benign prostatic hyperplasia is a non-cancerous enlargement of the prostate, often occurring as men age. The symptoms include frequent urination, a weak urine stream, and the feeling of incomplete bladder emptying. Now, while this benign prostatic hyperplasia is not cancerous, it can significantly impact the quality of life of men. There are various factors that can contribute to benign prostatic hyperplasia, including aging, hormonal changes, and the family history of prostate issues. Lifestyle factors as well, such as obesity and lack of physical activity, may also play a role. Now, if you're experiencing symptoms, it's crucial to consult a healthcare professional. Diagnosis may involve a physical exam, PSA blood test, or imaging studies. Treatment options range from lifestyle changes and medications to surgical procedures, depending on the severity. Now, let's shift our focus to prostate cancer, which is one of the most common cancers among men. It typically develops slowly and may not show symptoms in its early stages. Age, family history, and race are known risk factors for prostate cancer. Some lifestyle factors, such as diet and exposure to certain chemicals, may also contribute to the formation of prostate cancer. Early detection is critical for successful treatment. Regular screenings, including the PSA blood test and digital rectal examination, aid in identifying potential issues. A biopsy might be recommended if abnormalities are detected. Now, treatment options for prostate cancer vary, ranging from active surveillance for slow-growing tumors to surgery, radiation therapy, and hormone therapy for more aggressive cases. The choice depends on factors like the cancer stage and the patient's overall health. Wrapping up, maintaining prostate health is vital for the overall well-being of men, especially after the age of 50. Regular checkups, a healthy lifestyle, and awareness of potential symptoms are crucial. If you have concerns, don't hesitate to consult with a healthcare professional. Thanks for watching the video. Be sure to support the channel by subscribing and checking out the playlists you can see on your screen right now. Until next time, bye for now.